Hello, this is AILEE News, giving you useful medical information. Today, let's continue to learn how to read sutures, following the last video. For example, when you read the sutures, what says 50 should be read as 50 or 50. So, the name of this thread is PGA50. Also, if you look at the picture, it's a thread with a needle length of 11 millimeters and 3/8 circle. The thread is 45 centimeters long, and that triangular figure means that this suture is a reversed cutting needle. Let's have a look at another picture now. This thread is read as 10 or 10, and the name of this thread is KET10. It is a 37 millimeters needle length thread with 1/2 circle. The thread is 75 centimeters long, and the round shape picture means it's a round needle. When we look at the thickness of the suture, the specification of the thickness of the suture is expressed in metric units or on a numerical scale standardized according to USP regulations. Metric ICE of European Pharmacopoeia. In addition, the commonly used USP standard is of the United States Pharmacopoeia. If you take a look at this table, the thickness of the suture increases as you go down from 11/0 to 2. From threads of thickness from 10/0 to 11/0 are mainly used for corneal transplantation, and threads of thickness from 8/0 to 9/0 are often used for ophthalmic surgery. In addition, depending on the type of the artery, 2/0 to 8/0 are used for vessel anastomosis, and threads of thickness from 2/0 to 4/0 are often used for organ anastomosis. 1/0 to 1 thick thread is mainly used to suture abdomen, and 2 to 7/0 threads are mainly used for surgery. Next, to talk about the radius of the suture needle, 1/2 of a circle is most commonly used, mostly for the skin, blood vessels, muscles, tendons, nerves, digestive tract, respiratory tract, nasal cavity. For 1/4 circle, it's used on thin parts for eye surgery or microscopic surgery. 3/8 circle is used for skin, blood vessels, tendons, nerves, digestive tract, peritoneum, and fascia surgery. The 5/8 circle is used for very deep and narrow pelvic tissue, urology, nasal cavity, oral cavity, and dental surgery. And the size of the needle varies greatly. It depends on the type of needle, but it usually ranges from 12 millimeters to 80 millimeters. AILEE also manufactures its own 3 millimeters microneedles and is mainly used for microbonding surgery and cardiovascular surgery. There are 7 needle point shapes: taper point, blunt point, taper cut, reverse cutting, spatula point, diamond, and trocar point. Let's have a look at the characteristics of point shapes. A taper point is a needle that is generally used with a circular body, but a tapering shape to the tip of the needle. It is mainly used in the peritoneum, abdominal organs, myocardium, dura mater, subcutaneous tissue, muscle layer, digestive tract, nerves. Blunt point is a needle with a round body and a blunt tip. It minimizes the tissue incision and provides excellent stability. It is mainly used to suture parts with a lot of blood vessels, such as the liver and kidneys. And reverse cutting needle, which is in the shape of an inverted triangle, is used for tough areas and hard tissues, like the skin, because of its sharp tip. It is widely used in tissues that are difficult to treat, such as skin and oral mucosa. Today, we learned how to read sutures. Thanks for watching. This is AILEE News. Have a great day.